Dear viewers, I am Dr. Mohammad Samiuzzama, consultant cardiologist and physician. My cell number is 9885031480. I am going to give you some brief details about coronary artery disease because nowadays thousands of lakhs of people are getting heart attack and coronary artery disease. So what it happens, how it happens, I will give you some brief introduction. Heart is supplied by three coronary arteries, like our hand is supplied by arteries. Similarly, heart is also supplied by three coronary arteries, and by the time passes, every person gets some deposition in the coronary arteries blood vessels under the inner layer of the artery, that is called as endothelium. Suppose this is the inner layer of the coronary artery. So here some matter is gets deposited. For example, some cholesterol, some other things. This is called as atherosclerosis. If it is happen in other parts of the body, the problem will not be more. But if it is over the heart, the blood supply is reduced. So a patient who is having this atherosclerosis, blood supply to the heart is reduced. So whenever he works or exerts himself, he gets some chest pain because blood supply and oxygen supply is reduced. Very rarely what it happens, this inner layer ruptures. Suppose this is the inner layer, it ruptures, and the rough material of the deposition gets exposed, and the blood passing through here, the platelets they try to close this ruptured area, and they get adhered and they form a clot. So that if the clot is very much big, the further supply to the heart is reduced in other areas of the heart. If major arteries are get blocked, then the supply to a major area of the heart is compromised, and patient gets severe chest pain and heart attack. So what a person should do, medicines, what the lifestyle management I will give in some other other video, but now I am telling what medicines the doctors give generally. They give tablets for controlling cholesterol, like statins and other drugs, and they give a drug called antiplatelet. That is, it blocks the mechanism of clot formation. So these two tablets and these two medicines are the basic drugs in coronary artery disease treatment. So one should consult a doctor whenever he gets chest pain, and he should try to take medicines for a very long time till doctors